And with that, please take your seat in the special box for invitees, following which we continue to another element in our agenda, which is the panel discussion, which will be taking place right here on the stage. And we're happy to welcome our panelists who will take part in this event. Most of them have been presenting here today as speakers, as well as in the opening ceremony of our summit. So with that, happy to welcome once again Boris Lushniak, former Surgeon General of the United States and Dean of the Public Health School, University of Maryland. Also, Boris introduced that the entire community should not save any efforts in their palms in clapping hard enough. Scott Giberson, former Deputy Surgeon General, the President, AMI Expeditionary Health, Admiral retired. Please welcome. Surgeon General of the Armed Forces of Ukraine, Sub-Colonel Medical Service, Kostyantyn Gumeniyuk. And we are also happy to invite into this male team, a representative of the Unbroken project, chair of the first medical unit in Lviv, Iryna Zaslavets. Please welcome. And Iryna, please join the team. So the discussion today here will be on leadership in crisis situations. And with that, this is not a matter of any further introductions, but rather handing over the microphone for moderation to Boris. You are welcome.
Panel discussion. Critical that the audience be involved. We'll save some time to the end of it for questions. And again, the theme is, notice how we went from talking about various aspects. I discussed public health. We went to the surgical, to medic training, to very hands-on. And yet in the midst of all this, there is always that sense of, let's come back a little bit and discuss something such as the topic that we have in front of us now, which is leadership, and specifically leadership under crisis. We have some incredible leaders here, both in Ukraine as well as in the United States. I am happy to be the moderator here, and I will ask questions. And we'll have, obviously, the translators taking care of the translations of the question. First, I'd like to introduce this panel once again and just go a little bit deeper into who they are. So to my left is Rear Admiral retired Scott Giberson, also served along with me for 27 years in the United States Public Health Service Commission Corps in the United States. He's currently the president of AMI Expeditionary Healthcare. He retired as a two-star admiral and had served, oddly enough, at the time that I was asked to serve as the acting Surgeon General of the United States. Scott was my right-hand man, although he's sitting on my left-hand side now, as the acting Deputy Surgeon General. So Scott and I go back many years. He led our response to Ebola in Liberia. Both of us served in Liberia, taking care of Ebola patients, and he is an incredible leader. He is a proven leader through challenging health crises, both in the U.S. and abroad. And in 2018, the Military Officers Association of America selected him as one of the top 100 veterans in the last 100 years that you need to know. Welcome, Admiral Giberson. It's really a privilege, and I discussed him a little bit during my talk, but we have here, are you getting is everything working?
I have a problem.
Okay, we have a problem, the headset here, so if we can have somebody from technical assist. But I'll introduce him. Dr. Kostyantyn Gumeniyuk is currently the chief surgeon of the Armed Forces of Ukraine, a colonel in the Ukrainian Medical Service. He's a candidate of medical science and associate professor at the National Military Medical Clinical Center. He'll be speaking on many topics at this summit, including organizational aspects of surgical care in the context of war, modern combat trauma, new methods of diagnosis and treatment. So he is a clinical person, but today we're going to be delving into his world of leadership and specifically crisis leadership. Welcome, Dr. Gumeniyuk.
Thank you very much.
And then, you know, in English, we have a term We have a term that we should actually have Pani Iryna sitting in the middle here, of the rose amongst the thorns here. And so thank you for adding some color to this drab group of panelists. Ms. Zaslavets, Iryna Zaslavets, is currently the CEO of UNBROKEN. She's also the Director of Development of the First Lviv Territorial Medical Union. And as a leader of the large non-governmental organization and entrepreneur, Ms. Zaslavets was instrumental in the establishment and oversight of a group called UNBROKEN and its National Rehabilitation Center. This is a unique place where adults and children that are affected by the war can receive comprehensive, qualified medical care. It includes reconstructive surgery, orthopedics, robotic prosthetics. That is an incredible mission at a very timely time period here in Ukraine's history. She also, and this has assisted over 15,000 people thus far. She herself is a cancer survivor and is also passionate about supporting organ donation. And I think that's a key feature of what she brings to the table as well in terms of her leadership and passion for that cause. Welcome, Ms. Zaslavets, and thank you for joining us on this panel. So we're going to sort of go across the room, and there'll be specific questions directed. It will be similar questions to all. All panelists were given the questions beforehand so that they had at least the thought process to be able to prepare themselves for. And I'm going to stop with Scott to my left here. Scott, what do you believe are the most important leadership competencies during a crisis?
Thanks, Boris. So first I want to say thank you to the hosts and everybody to have us here. This is a really unique situation, and it's when you get asked to speak, you always say that it's you're grateful and it's an honor. But in this situation, it is truly a privilege to be sharing the stage, especially with military medical leadership, NGOs that are fighting the battle here on the front lines in Ukraine. So truly a privilege in this situation and during the crisis. So this is an example of how you have collaboration, which is important for leadership. So you have, the military and military medicine. You have an NGO, non-governmental. You have city representation with the city government. You have myself, a retired military, Admiral Lushniak, retired as well, but all in the health field and health leadership. And I think it's often overlooked and undervalued that how much leadership impacts the results. I think we could see that in America with leadership in certain times during the pandemic, how leadership impacts the results. Could be very positive, could be very negative. So I think it's very important to discuss this. And I think when you first think about crisis leadership, you really think about crisis management. And here's what I mean by that is because what we train on and what we practice is not truly crisis leadership. We practice what we plan for. We plan for the command and control. We plan for the logistics, the operations, the communication methodologies or modalities. And that's crisis management. But crisis leadership is a little different. So hopefully, now I'll give you three things actually that I believe are really important for crisis leadership. And the first is assessment skills and awareness skills, and particularly situational awareness. And I say that because as a leader, you have to be situationally aware of every level of the response. Now, you do get reports up from your people, but you should have an idea or a sense of how to lead for each of those levels. I'll go into that in a little bit more detail in the future, but that awareness level is very important for any leader. The second thing is communication. Communication is probably one of the more challenging competencies of a leader. Usually, the leader will have more information than everybody else. At least they should have more information about all the facets of the crisis. They don't have all the details about each facet, but they have the most information about all. And they have to balance the communication to make sure they assure transparency. At the same time, not everybody needs to know every single thing about it because it's inefficient. So the crisis leadership or leader has to think communications and the best way to do it. The last is the ability to build trust. And that sometimes and often comes before the crisis even happens. So building trust is an incredibly important skill set to have as a leader. Whether it's the ability to be authentic, whether it's the ability to speak truth to whatever is needed and be frank with people, but to build that trust and to build the coalitions and build the teams before the crisis happens is probably the best way to do it. Now, all those three things. So you have the awareness capabilities, the building the trust, and you have communication skills. All those things increase stability. And so during a crisis, what's most needed is stability, and stability for your team so that they can be the most productive. So I think that those three things combine, and the leader sets the tone, we say. It sort of sets the stage for how the whole crisis will evolve. And when you have the leaders with those three competencies and the leader that creates stability, you'll have good outcomes.
Colonel, do you have anything to add? Anything on the competencies, the skill sets necessary for a leader?
Так, шановні колеги, шановні присутні, ви знаєте, я так скажу, що в Україні підготовка лідерів, ну фактично
And
вона
that
була
leaders
відсутня.
training in Ukraine has been absent, missing, unavailable, capitalized letter M. For your knowledge, in our Academy of Armed Forces, we have started a leadership training course for the first time ever only 2 years ago. And this is the first time ever when commanders, officers come to special training which helps them to make decisions, implement decisions, and supervise implementation of such orders and decisions, particularly in a crisis situation. Because in many cases, there would be voluntary leadership manifestation, including combat settings. And that would be the case when an officer, commanding officer in a given situation at a given time, is bold enough to say what should be done, how that should be done. And I do remember 2014 when our leaders were intuitive, and these were officers who were capable enough, either by nature or training, who would be strong enough and brave enough to make a decision, to bring people together, to manage them appropriately. Thank you for saying management is important, because indeed you should manage the case in order to have the crisis under control. And definitely there are different factors contributing to such leadership skills developing, building, because there are some genetic factors and there's experience also as a factor when this is learning by doing. But this is the hard way to learn, I have to admit. Nevertheless, if you're a diligent student, you will learn how to become a leader. And again, I'm the leading surgeon. I'm the Surgeon General in the Armed Forces of Ukraine. So I have to be a leader. I have to demonstrate how to perform surgery in any kind of setting, in any kind of case, in any kind of patient situation. But definitely, me by myself, it's impossible to clone myself or replicate myself, to be present everywhere in the front line. And that's where my management skills start defining whether or not I'm talented, skilled, and capable enough to demonstrate, show, and teach other surgeons what they should be doing in different settings, in different case scenario. And also arrange all of the necessary resources and tools and systems in place to enable them to deliver their function. So definitely this requires organizational skills, but also personal skills, because to become a leader, you have to make sure that you are not just saying things out loud, but every word you say is heard, understood, and implemented. And then can be done in the spirit of mutual understanding, collaboration, communication, and partnership. And in order to have people listening to you, you have to be honest, you have to be open, you have to be honest to yourself to make sure that you are honest to everybody else, and that honesty will be appreciated.
You have now a perspective that you add to this group. From the civilian world, from your past life, you were a journalist, you were a news broadcaster, you probably covered leaders, right? You were there behind evaluating good leaders and not so good leaders, and now you're a leader yourself in all this movement. What is your perspective in terms of the skills, the competencies of leadership?
Thank you. This is a very special question, and I have a very special microphone to use for answering it. And I would like to start answering a question by saying that every partner invited to our center as well as every patient. And you've seen our performance reports. We are talking about hundreds and thousands of patients. And indeed, we are opening new operations, new activities, new interventions, prosthetic care, orthotic care, and everything else. And every partner who comes to see our operation, they are questioning whether or not we are a non-governmental organization just looking at the state-of-the-art equipment and settings that we have. Well, on the other hand, the fact that we are non-governmental organizations give us freedom, because we have some flexibility. Even if there are no resources, we can improvise a new department, a new operation, a new type of service. And we have to be inventive and creative in finding new opportunities, in finding new partners, in finding new providers which can be invited in such flexible manner of performance. Also, we understand that the world that we lived in the past tense does not exist any longer in modern day. And thus, we have to look for new solutions, new techniques, new materials and resources, new technologies, because there is a growing demand. And sometimes our demand is growing so fast, with such major gravity, that our suppliers are stricken by the ambition that we demonstrate. Sometimes we might request that our suppliers are asking for half a year or year and a half in order to have it manufactured, supplied, and imported into the country. But we understand that we don't have a year to wait, and we have to be creative in our survival strategies. There is survival strategy in the front line, and we have a survival strategy here in the rear when we're dealing with the patients. And that's where the non-governmental sector, being so free, flexible, and ambitious to generate these new solutions, building on the experience you share, but again, taking this to the next stage. And that's what the leadership is about. Not only to learn how to do something in the good, new way, but also being bold enough to ask for more expertise, to come from those who has such experience, to be ambitious to build the team and to inspire the team with a greater ambition, and indeed to communicate within the team, with your peers, or with your counterparts in the country and outside of the country. But also, to be a leader means to show how to do that in a more ambitious manner.
What has been the most challenging crisis that you have encountered as a leader, and how have you approached that? Значить, різного роду кризи, які відбуватимуться. Яка
what is the most important, the high severity crisis for you in Ukraine, and how will you reacted to this? Thank you for your question. It's out of a question that the most important reasons for us was the war. But despite the fact that I am on the front line from 2015, but anyway, for the military surgeon, the crisis situation faced every year and every day, and every surgeon, this is always have to decide and to make a decision, because it's always easy to see some operation of surgical atlas, but or stop the bleeding. But anyway, the fact of the fact, it's really hard to do it in real life on the surgical and the real surgery. And it occurred to my mind one of my clinical cases, and it was published in the article when one of the severe damaged warrior was admitted with a severe damage of kidney, and have to decide what is the best way to perform the operation, or to perform it through laparotomy, or to do it with a manual surgery, laparoscopy. But the matter of fact, it's really hard to find an experience experience on the level 2 to perform the laparoscopy, and you can imagine my situation when I have to make my decision, and I have to, and I've made my decision to do it through laparoscopy approach. And it was actually the first in the world, and it actually was a great challenge for me, and it was rotten a lot of, but the fact is to treat our patient, our very patient, and I have to, and I performed it through laparoscopy approach, and I have to remove the damaged kidney, and I have to say that we saved the life of this warrior, and I input this clinical case in my presentation, and it was a great challenge for me. You can imagine to perform the surgery for the first time in the whole world, but the priority was to decide to save the life of our warrior. What is your approach to this problem? And I suppose that all the leaders in Ukraine have been a really severe crisis. It's emotional overloading, and the fact is we don't have the right recipe to overtook this challenge, and we have to say that first work was of the war. It was really hard for us to remember it and to recall it, because all of us was a great challenge for us, and we've got the situation day by day, and we have to come back to work and do our work at night as well, and to do the best. And we believe that we've got the idea that tomorrow will be the victory. And as far as we still have this war situation, and people start to feel the exhaustion, and even the people who are not only all the medical staff, they are really exhausted, and due to the fact that this is a normal situation for the people to get on vacation, and there is no possibility for them to go somewhere to have some rest, and you have just get back to your work and do your best. And you have to continue, and you have to keep walking and walking, and we have to admit that our strength getting less and less, and we have to say that our psychiatrists work with our warrior, and they work as well for our medical staff, and they try to work out to support them, and even some cultural event established for supporting of our people and for our staff. And sometimes we even have to force our medical staff to go to vacation and to go somewhere to have some rest. And this is actually this crisis that we are facing, all of us in Ukraine, and we have to admit that we have to have some rest from time to time, because only this way will help us to keep struggling and working. And moreover, we have to concentrate on our result that we've got every day. And but sometimes it could be possible to someone to accept like your result getting less and less, but you have to force yourself to force your staff to believe in their result and their role in the struggle.
How you dealt with it, and the answer cannot be that the crisis that you had was working with me. So that's not on the table.
So being in uniform, we're familiar with war right now. The ongoing crisis is the war, and both of their answers were really appropriate for this. And I'll bring a different aspect in because we're talking about medical and health and pandemics. in 2013 and 2014, actually 2014, 2015, we had the largest outbreak of Ebola in West Africa that was ever documented. And the world was in fear and had a lot of anxiety. President Obama, during the Obama administration, is when we served as the Surgeon General, Deputy Surgeon General. And luckily, I was afforded the opportunity to command the response for our service for Ebola in West Africa. And one of the primary missions was to stand up Ebola treatment unit for healthcare workers. It would be the only one in West Africa for healthcare workers to be treated if they were infected with Ebola. So very unique, very different type of crisis. However, a lot of similarities to some of the things in war. For example, the case fatality rate of Ebola is anywhere probably between 40% at the very best medical care possible to almost 90% case fatality rate. So if you do get Ebola, there's a very high chance you're going to die. And that is a lot of pressure in terms of making sure the response was a good response and successful outcomes. So you paint the picture of that time, largest outbreak ever. We had a very visible response, meaning everybody in the world knew about it. Our president tasked us to do a good job. And that wasn't very much pressure, and I'm being facetious when I say that. You had multiple stakeholders that had that needed certain outcomes, whether it was the host countries, the ambassadors, the presidents of multiple countries, and your men and women who were serving on the front lines taking care of people with Ebola. So this was a crisis with many leadership challenges and a lot of uncertainty around the world, which created anxiety for even the frontline troops, much as if they were in the front lines of the war. So my approach to all of that was to understand and assess the situation at every level. So another one of the opportunities we had was that it was the ability to be in the hot zone as a clinician, and then to go all the way up through the different levels of needs, whether it was tactical, operational, or strategic, all the way to the White House and the President of the United States. So having those experiences gave you a lot of leadership competencies that you had to deploy to be successful. I tried to separate each of those into tactical first, meaning the troops, the men and women that were on the front lines. What were their needs? Their needs may have been just to refocus their uncertainty and some anxiety to the skill sets that they are familiar with, how to take care of patients, how to interview patients, how to make sure the patient is taken care of in the best way possible so that they didn't waste energy on focusing on the fear or the anxiety they had, and they focused on what they can do and what they know well and what they practice every day at the tactical level. How to take care of the troops from return from taking care of people with Ebola, right? There's a lot of trauma, seeing the people die and knowing that they take care of a person and every other one would die. That's very difficult on people, right? So we went from that to the operational level, when you think more systems and processes, how to implement the things for operations, all the way to the strategic level, which was probably the most difficult and challenging for me as a leader, because you had the political influence. There was a certain political outcome and a certain outcome we all needed. There was the health outcome, meaning making sure everybody was safe and we were effective in treating other healthcare workers in other countries. And then there was the just pure visibility of it, because if you were interviewed on TV, you get to go on CNN and ABC, and your consultant and you're on the radio. And if you say one wrong thing, it certainly is highlighted and it spreads like a virus. So it was a very challenging situation, but by separating those things and addressing each of the needs at the different levels, it was easier for me to meet their needs. And because as a leader, I'm supportive of what their needs are. So the best advice I could give is to be adaptable in deploying your leadership competencies to make sure that what you're giving out is what their needs and fulfilling their needs.
Thank you, Scott. Дорогі учасники, тепер мікрофон вам відкритий.
You can provide your questions.
Three different perspectives. So if anybody has a question on leadership, please stand up. Yes, Heidi. Well, hold on. I think we're going to get you a microphone. Do we have a microphone out there? No. Okay, here it comes, here it comes.
I've heard each of you talk about the importance of taking care of your troops. How do you take care of yourselves, especially when you're in the moment of crisis?
Дякую, що про нас теж турбуєтеся. Хочу сказати, що все, що ми радимо своїм колегам і все, що робимо для колективу, ми маємо в першу чергу приймати для себе. Так? І це психологічна допомога, превентивно, там, кожного тижня я маю консультації із психотерапевтом тільки через те, що це має бути у нашому світі, в суспільстві, коли ми всі живемо в стресі, в напрузі кожного дня, мати можливість проговорювати, концентруватися на якихось речах, якісь речі пропрацьовувати. Тому я це роблю для себе і обов'язково так само раджу для своїх колег. І маючи, що дуже важливо в нашому лікарні.
And I suppose all of us will face this problem in the Department of Psychiatrists. And unfortunately, we have the situation in our life to ask the consultation of psychiatrists and not wait for the period of time when we are in depression and you want to cry all the time. But you have to use the psychiatrist consultation for everyday life activity in order to prevent it. And for the patient who lost the extremities and after some operation, and moreover we have some problem with psychiatry and mental health, and a lot of people and hundreds of people who will suffer from that and will face this problem. And I can say more that we already have faced this problem with the mental health. And unfortunately, we don't have such habit for our Ukrainian people to visit psychotherapists and people with the confusion. And for the people with the confusion, and we have to understand that for these people with the mental health disorder, they have to have a good thinking. But unfortunately, this is not for all us. We can say that. And we can have to use the therapeutics to treat this patient. And I touch another question, and I suppose it will be another challenge for our medicine in Ukraine. And that is why it's also important to follow some results and outcomes in the United States, where there are a lot of patients and some delayed outcomes for these mental health disorders. And we actually can use it because we are in lack of this knowledge. And we are lack of these special medicines, and that is why it's really important for us to use the experience of the United States, because every Ukrainian citizen have to understand this is absolutely normal to make a date and consultation with the therapist. One more question for the colonel.
Yes, please. Thanks so much for this kind of important topics which you are highlighting. And creation of leaders, forming of leaders in this crisis situation, that's something beyond the routine work or skills. That's about the organization, that's about setting up the things which we are not thinking about in our simple and everyday routine. The question is rather simple. In May this year, I was honored together with my colleagues, doctors, to have an internship in London regarding the trauma course. And one of the lectures was the moment when the lecturer was the head of the London Air Ambulance. He was the lecturer, he was the head of the air service in the healthcare in London, and his lecture his lecture was the following. He was delivering the message that in the emergency aviation and the helicopter service, there are certain algorithms and rules on how to prevent errors happening, and how to deal with the crisis situations, and how to communicate with people in crisis situation, and also early detection and prevention of crisis situation. But crisis situations are constant. They constantly happen. And the same, dear Dr. Gumeniyuk has mentioned that in our work, and as anesthesiologists or surgeons, we are working in the operating room as in the crisis situation. Medicine is having to deal with a lot of medical situations, but the decision tree, that's the issue. The question is the following: what do you think about to get the experience from the military aviation? Because in the military aviation, there is this algorithm, there is this wheel invented in order to have a proper communication and interdisciplinary, multidisciplinary communication, which is happening, for example, among those who work in the aviation service. In order for us here in Ukraine to know how to, with the cold mind, to approach the decision-making process and to approach it not only in terms of the medicine, near the bed of the patient or in the operating room or during the anesthesia or intervention, but how to take decisions when there is a crisis in the environment and we are getting beyond the comfort zone and everything is on fire, basically. For us to know how to communicate in those crisis situations, how to deal as leaders. Yeah, thanks a lot for the question. You know, in these leadership courses, which we have mentioned previously, for the first time it was mentioned in Ukraine, and armed forces of Ukraine train the military personnel. And actually, according to those NATO standards, we are preparing the military personnel to act in the crisis situation. So it's not just about logistics, which covers any kind of anesthesiologist or combat medic. It's about the logistics of communication with the environment in which we are operating. That's extremely important, and I fully agree with you. And in these courses, there is a training which is happening in terms of this decision-making. Yeah, thanks. We are getting to the end, but still, you have an opportunity to ask questions during the lunch.
To finish it, right? So, what overall advice would you give other leaders to be successful in dealing with a crisis? You talked about competencies. You have 1 minute, and you're on about the final word.
Thanks. Okay, 1 minute. So 3 things. One, I talked about situational awareness. First is self-awareness. As a leader, you have to know how you're perceived by others. You have to know your strengths, you have to know your areas for development, and you have to know those right up front before you even start. Second thing, put competence around you. There's no way a leader can make all the right decisions or even make decisions about certain topics. Put exceptional people around you. And this is really hard for leaders because if you think about it, if you put competence around you, sometimes you don't look like the most significant person. So it has to be, you have to have humility. And humility is a very important trait for a leader. And the third thing is to inspire people. And with inspiration, just like positive psychology, you get increased performance, increased productivity, and it's best in crisis.
So as we complete this session, I do want to put in my 30 seconds, which is one is never an expert leader. We've heard from 3 incredible leaders here. And yet, while I will strive to make sure that you fully walk away from this session, is all will admit that they are constantly learning as leaders. They are constantly observing leaders, right? I have learned from the best leaders around me, and sometimes I learn even more from the worst leaders around me. What do I want to be, and what do I not want to be? But we are constantly students of leadership. Тепер до обіду, тепер буде нам час розмовляти, час відпочати І так, пане ведучий, мікрофон до вас.
Dear moderator, I give a floor to you. And you have this opportunity right now to say thanks to these great four leaders. Please, Scott Giberson, Kostyantyn, Gumeniyuk, Iryna, Zaslavets, and moderator of this leadership in crisis situation, Boris Lushniak. Thanks so much. Thanks so much, dear colleagues. Thanks so much, dear friends. Thanks a lot that you are concentrated and that you are aimed towards having those discussions. Thanks a lot for those great questions. Right now, we have an important information, so please listen to me carefully. Oh, you do remember that we have an online broadcast. We have a hoping broadcast happening, and I've heard that from the organizers that there was some technical issues and we were unable to record everything from the beginning. That's why we are going to try to repeat everything that was happening from the 9 in the morning. So let's start. Good morning, dear guests. Okay, everybody's saying hooray. No, Boris said everything correctly. Everything is doing well. We are doing well with questions, with jokes, and with timing. That's why with huge pleasure, I'm going to announce that we are going to have half an hour for the lunch break for everybody in the audience. So lunch is at the same place where the coffee break was happening. Just get some food, get something delicious, and see you soon.